You're listening to Peel Talks Housing, the Region Appeals podcast delving deep into complex issues around affordable housing and homelessness and efforts to help residents get and keep housing. Episodes will feature residents with lived experience, Region Appeals staff, our partners, academics, policymakers, and other leading voices in the affordable housing sector. The opinions expressed in this podcast are those of the individuals expressing them and may not reflect the opinions of the Region of Peel or the direction provided by the Region Appeals Council. Hey everybody, my name is Axel Villamil and welcome to Peel Talks Housing. I'm your host for today, and today's topic of discussion is housing and health and why integration matters. We are joined today by two amazing guests, Dr. Nahid Hassani and Leslie Moreau. Welcome to the show.
Thanks for having us on.
Thank you.
You're welcome. It's a pleasure to be here. Unfortunately, it's virtual. I always love the energy in the room, but that's okay. We're going to have a great conversation nonetheless. I would love if you both tell us a little more about what you do, starting with Leslie.
So I am the manager of client services at the Region of Peel in the housing department. I'm responsible for everything that touches the client. So everything from eviction prevention through to the centralized wait list, subsidy, and then also all of our contracts with our service providers who deliver homelessness supports in the community. So the shelters, the outreach team, and programs such as that.
Wow, sounds like everything. Okay. Dr. Nahid.
Yeah, my name is Dr. Nahid Hassani, and I'm a physician who spends a lot of time providing healthcare for people who experience homelessness and poverty. I work in shelters, on the streets, I work in hospital, but since 2020, I've had the honor and privilege of serving as the medical director for the Region of Peel's COVID-19 isolation housing program, bringing isolation and housing supports to people who experience homelessness in the Region of Peel in the midst of a public health crisis, COVID-19. And I've had the pleasure of working with Leslie as my teammate since 2020. It's been a real run, right, Leslie?
Absolutely.
I love it. No big deal. No big deal during the pandemic. It's quite the role to take on. I mean, it sounds like you two are doing, quite a lot of work and amazing work during a very interesting time in the world. But I'd like to talk about how the Region of Peel and its partners responded to the healthcare needs of homeless and other vulnerable people during the pandemic. So isolation and recovery sites were established and a number of services and supports provided. Can you both take me through that process?
Yeah, absolutely, Axel. So interesting to note is Nahid and I actually participated in a conference of such, a learning opportunity through the Rotman School of Business several years prior. And when the pandemic hit, he was the first person I thought about. I was like, we need to have some health professionals working with us, obviously, to serve the homeless during the pandemic. So I reached out to him, and Nahid and I started to plan what sort of supports would be needed for those experiencing homelessness during the pandemic.
And just to, add on to that, I think one of the things that's important to recognize is that, while many regions across the country have systems to support people experiencing homelessness from a healthcare perspective, other regions don't. And, in general, there's been a patchwork network of systems that have supported people. And Leslie and her team were super instrumental in developing, hiring, and putting together a new intervention to support people in the midst of a pandemic, spanning across the Region of Peel and across the continuum of homelessness, which I'm sure we'll talk about as well.
Absolutely. I mean, it sounds like Peel is very fortunate to have you two. But I would say in the result of this work, alongside you two and your colleagues, would you say it's now easier for people experiencing homelessness in Peel to access healthcare?
Yes, it's easier than it was before, but we have a ways to go. What we did is we brought in the isolation and the recovery program for those who were experiencing COVID symptoms or screened positive for COVID. And then they received those health supports while they were in isolation. The great thing that happened is they received supports for other health issues while they were also receiving supports for the COVID. So we saw some great results coming to us, both hearing from our clients, but also some good housing outcomes. But today, I wouldn't say it is easier than it was prior to the pandemic because we've built these great relationships with the medical community. But we've got a ways to go before they have the kind of services that they need ongoing.
Dr. Nahid, any thoughts on that too?
I think one has to realize that what's happened during COVID-19 is it's put people's vulnerability at the forefront. We've seen how this is not just a virus, it's a virus that preys on people who experience structural vulnerabilities like housing insecurity, poverty. We know that, race and even systemic racism is a huge factor in who's getting COVID-19, people with disabilities, so on and so forth. And so, the response in the region of Peel really highlighted the importance of healthcare options for people who experience those kinds of vulnerabilities. And, the kinds of people we were supporting in these isolation and recovery programs definitely evolved as the months and the years kind of extended throughout the pandemic. I'm thinking of several people we cared for, including men who were experiencing homelessness, living in congregate style settings where there wasn't a lot of space to social distance. Remember, this was all before vaccines. I'm thinking of families who had difficulty in their settings, isolating when someone got sick or had symptoms. But as the actual pandemic went on, we started to support, not just people who met that traditional definition of homelessness that we all are more comfortable with, but also essential workers in our communities who were working on the front lines of the COVID crisis in production plants and factories, people who are at home living in multi-generational households who needed space to isolate, and of course, the social and health supports that come with that. So, it really did span a great a diversity of experiences and the kinds of people we were serving through the program.
It sounds like through the pandemic, even though, it's quite a difficult time, we all realized a lot. We discovered a lot, I think, as a human race, but even down to the region of Peel. With us on the topic of housing, you really touched upon that. It sounds like healthcare and housing is kind of it's hand in hand. Now, I'd ask to you both, why should health and housing be more integrated? Do you think it should be more integrated?
Yeah. So, I think we know in 2022, especially from what we've learned through the pandemic, that, people's healthcare outcomes are inextricably linked to their access to the social determinants of health. People who experience homelessness in a country like Canada have life expectancies that range between 34 and 47 years old, whereas people who are housed lived upwards of 77 to 82 years old. Homelessness is a terminal condition. In essence, people experiencing homelessness are 28 times more likely to have hepatitis C, 5 times more likely to have heart disease, 4 times more likely to have cancer. And so there's no doubt that a connection to access to high quality, safe housing is such a huge part of what it means to be healthy. I think it's something that a lot of people take for granted because many people have a roof over their head. But what we saw in this pandemic was the impacts were very real. And in fact, what we do know is that, when it came to COVID-19 in wave 1 and wave 2, we know that unhoused people right here in Ontario were 20 times more likely to be hospitalized, 10 times more likely to be in ICU, and 5 times more likely to die. So certainly programs and interventions like what we were working on in the region of Peel were a life and death matter, for real.
And then from the housing perspective, from bringing healthcare in to see the housing outcomes that we were getting, not everybody is able to live independently in the community. They need access to long-term care, group home kind of settings, housing with supports. And in order to gain access to many of those supports that are so needed, you really need a partnership with healthcare in order to have the individuals referred properly and diagnosed properly. And so we started to see those sorts of outcomes as well. People actually leaving our isolation and recovery sites and entering into long-term housing without ever going back to a shelter. So we know
Interesting,
that it works.
because that was my next, I guess, rebuttal here, where there are those people who may say that, having better health care in shelters can have them stay longer at the shelters. Now, I would love for both of your opinions on what you would say to people who think like that.
Well, I think the first thing I'd say is someone who's kind of worked for years and years on the streets and in shelters. I've never met a person who actually wanted to be someone who was experiencing homelessness. Homelessness may be related to some poor decisions that people make over their lifetime, but more often than not is the result of systemic policy failures around a weakening social safety net, income supports, and an overall lack of compassion in our society and some aspect of unchecked capitalism, to be honest. And so, what we've seen over the years, and it really depends on the person you're talking to or talking about, is that, there are different pathways to the street. For some, pathways to the street have to do with, trauma from, childhood and youth. For others, it's people who have dealt with serious and persistent mental illness. And for others, it's just really bad luck due to an unfortunate sequence of events. Many people in Ontario are just a few paychecks away from being someone on the streets themselves. And so what we know is that when we provide people with supports around physical health and their mental health and their spiritual well-being overall, whatever that may mean, that people are much more likely to be housed. And so, a connection to access to healthcare is so important to helping people get off the street and become housed permanently.
And keeping people housed, right? We know that housing people is only one step in the journey. In order to keep people housed, you need the appropriate supports around them. And many times those are health supports that are needed.
Is talking about keeping people housed. So it sounds like, from the information that I know, that the Region of Peel's pandemic response, they had the desire to provide transformational wraparound supports to housing clients, and they'd like to create a permanent healthcare service delivery model for people experiencing homelessness in partnership with healthcare providers. So that the gains made during the pandemic aren't lost. All this work you've both been doing, want to make sure that we don't go back to having more people, homeless. So on March 24th, Regional Council approved using regional funds to extend healthcare services for the homeless for up to 19 months, while the permanent model is being designed. What do you think will be critical to the success of a permanent model?
It's been a long time coming, if you don't mind me saying, Leslie, for a permanent model of healthcare delivery in the region, which really gives us the opportunity to be able to serve the communities that need help and support in our community, similar to what's happening in other jurisdictions across Ontario. To Leslie's point, the future of healthcare delivery in the Region of Peel, our temporary model that we've kind of got approved, and the future model will allow us to really give people the kind of supports and help they need. I think it's important to really reflect on the fact that, technically everyone has access to the same healthcare supports in this country, but not everyone has equitable access to healthcare, and customized, tailored access to healthcare delivery for people experiencing homelessness is equitable. And I take it one step further, can be justice oriented, where people get the supports and resources they need when they want, how they want, where they want. And these announcements really just bring us one step further to that hope and that dream.
Absolutely, right. And we're going to need to work with our partners in the community in Peel in order to bring that permanent model to fruition and make sure that we have a model that will work for our municipality. It's important. Homelessness looks a little bit different in Peel than it looks in other municipalities. So we really want our model to be effective for the those who are experiencing homelessness in our community, and really be tied closely to housing outcomes, because we want to end homelessness as we provide healthcare to those who are experiencing.
That's a great point you touched on, Leslie, which is the fact that the model has to actually be very custom, for everybody, because it looks different everywhere, right? It's not a one size fits all type of thing. It's based on so many other factors. Now, as we think about that, would Peel benefit from dedicated funding for healthcare for the homeless? Like, why do you think Peel, as a large urban center in Ontario, has not received funding from the province for this when other areas such as Toronto, Ottawa, and Hamilton have?
Well, we're doing a lot of advocacy work to make sure that, and this is what the pandemic gave us as an opportunity to show the outcomes that we can achieve in our municipality. As to why we haven't had it up until now, I'm not sure, but we're looking forward, and we're really excited to bring this support to the population because, as you said, we're a large municipality, and homelessness looks different in Peel.
Yeah, when you look at the programs that exist, that service different cities and towns across Ontario and Canada, a lot of the history of these programs is history. Who was there first, who got funding. And while COVID-19 was certainly a tragedy and continues to be for so many who have suffered, the one silver lining can be that it put equity and health equity issues to the forefront, like healthcare delivery systems for people experiencing homelessness. And so I'm really excited to see what permanent funding can look like. And absolutely, a region like the region of Peel should have access to sustainable funding for people experiencing homelessness like any other region across the province or the country, because there are many people who experience homelessness in the region of Peel. I think sometimes our big cities in Canada, not to say that the region of Peel doesn't have big cities, because they do, but some of the bigger cities sometimes get a lot of press, and as they should. But there is, homelessness has a diverse face to it. It doesn't just happen in downtown urban centers, although that it does. It happens in suburban areas. It happens in rural areas. People are couch surfing. And I think as time goes on, more Canadians are being exposed to what the face of homelessness can look like. And it's more relatable than you might think. You might actually know somebody who may have experienced homelessness in the ways I'm describing along that continuum, or you yourself may have been in a situation in the past where you might relate to what it's like to not have a stable roof over your head. So it's all about definitions, and it's all about broadening our understanding of what it means to not have a stable roof over your head.
Absolutely. I'm really preventing myself from banging on the table in absolute agreement because the more I do these, and it's very interesting for all the people that listen, I am not an expert in this field. I am only somebody who's learning very much from the experts that I am here talking to today. And I feel the more we unpack this idea of what homelessness is that, like you said, Dr. Nahid, there's so many different faces to it, right? And whether it's not what everybody thinks is that here's a cardboard sign and a cup type of look. It's every shape, size, look. You could be clothed, you could not be clothed, you could be have a cell phone, you're not have a cell phone. You could be somewhere where it's not the big city. You could be somewhere in the suburbs. It's very different. And the fact that, we're talking about something as much of a necessity as healthcare, that is such a huge factor, is glad we're having this conversation, because if we can't get the press for Peel, through other means, we can absolutely do it ourselves through conversations like these, and that people are listening, we can, make that change. I guess my last question here for both of you is, any final thoughts or your number one takeaways from this conversation we've had?
Yeah, I think one of the things that I think about in a conversation like this as a takeaway is a firm reminder of something that we, probably Leslie and I already knew before the pandemic, but that really brought things home during the pandemic in the region of Peel, is that healthcare is a human right. And it should be something that is accessible to all in the ways that make sense for people. The COVID-19 pandemic was, again, such a tragedy, but it allowed the region to develop a model of care to support a often stigmatized and traumatized population through a health and human rights approach, through trauma-informed care, through harm reduction, to meet people where they're at, not just physically, but emotionally as well, to support their physical and mental health well-being, not just during a public health crisis, but to get them housed, right? And to improve their well-being overall, which can improve the community's well-being as well. And so I've been really grateful to be part of this initiative with Leslie and the team, and I look forward to what it can become in the years to come.
Yeah, and that's so well said, Nahid. But from me, I think that we could talk very similar with respect to housing, right? If you don't have a house to live in and a phone that how do you book your follow up tests that you might need from a healthcare perspective, and how do you recover from things like COVID and other things that happen to you if you don't have a home. And I think the other thing that I've really appreciated throughout this past couple of years is the magic that can happen when you pair, human services and healthcare together, and the reach that we have, and the connections and the relationships that we have can really be mobilized to get some great outcomes for our clients or patients, whatever we call them.
I think what a lot of people don't see are the unsung heroes that are actually working all together to make something happen. And Dr. Nahid, you said it really well too, which is it starts with the root of the community, right? To make the community even better. And that includes every single person of every status, whether you're housed or not housed. So going from basic needs and filling them up and getting them taken care of through amazing people like yourselves, that's where the community starts to shine and gets even better as it is. So I would love to thank you so much for being here, providing such an amazing conversation. And that wraps up this episode of Peel Talks Housing. Thank you so much, Dr. Nahid Dasani and Leslie Moreau, for joining us today.
Thanks so much.
Thanks, Axel.
You can find information about our podcast on our website, peelregion.ca, and you can join the conversation on the Region of Peel's social media accounts. The opinions expressed in this podcast are those of the individuals expressing them and may not reflect the opinions of the Region of Peel or the direction provided by the Region of Peel's Council.